feeling like a shark in a shrimp tank. Big fish, small pond in the shrimp tank. But it's sink or swim, only option is to win. In the murky water, not a thought of giving in.
Welcome back to the Shrimp Tank Tulsa post-show wrap-up. We just finished another great show with our guest today, Dr. Scott Reid with Tulsa Bone and Joint. If you want to hear about some of his experience in the Army, some of the great things that Tulsa Bone and Joint and Dr. Reid are doing, and some of the robotics that are going on in surgeries, you need to check out this video or check out this podcast. And so, Matt, why don't you start with what all did we talk about today?
Yeah, Dr. Reid, one of the things we talked about is you serving in the military. So can you tell the listeners what being in the Army meant for you in your career?
Yeah, I think being in the military was essentially a building experience for me. It enabled me to gain skills that I might not have otherwise gained, but it also opened some doors for me that allowed me to gain further training in my orthopedics career.
Sure.
Opened some doors that ended up eventually getting me back here to Tulsa doing what I like doing.
Awesome. So you talked a little bit about the good people that you have on your staff, and then you talked a little bit about how you keep them. So what's that philosophy for how you keep good people?
Yeah, very fortunate to have a team that is loyal to me, cares about me and the outcome of our patients. And I think being kind, treating them with respect, and then really showering them with gifts on occasion.
And maybe some breakfast every now and then.
That's right. That's right. If given the opportunity to start on time or show up with some breakfast, they'll take the breakfast every time.
Very good. One of the things we talked about is you actually have some pretty unique experiences, unique background in the types of surgeries that you do, some certificates, if you will. Can you tell the listeners kind of what those unique certificates are and what you specialize on a daily basis in surgery?
Yeah, so I do nothing but hip, knee, and shoulder. About a quarter of my practice is shoulder, a little over a quarter is hip, and then the remainder is knee replacement. I specialize really in joint replacements, and then within that, the unique stuff, I do a procedure called Hip Expert, superior approach for total hip, and that's really a very unique approach to doing hip replacement that allows patients to get up and move faster, recover quicker, less pain. And then I do also incorporate in some robotics into my knee replacement procedures as well.
Okay.
So, Dr. Reid, how can people out there find you if they're interested in learning more about Tulsa Bone and Joint, learning more about the robots or the 3D CT scans, or looking for a new hip or a knee?
So we have a very good website, tulsaboneandjoint.com. We can also be reached at our main office line, 918-392-1400.
Great. Well, Dr. Reid, thanks again for coming on the show. If you would like to see this show or a replay of any of our past shows, you can find us at tulsa.shrimptankpodcast.com or search us on iTunes in the search bar at Shrimp Tank Tulsa. So until next time, see y'all later.